My name is Dr. Stephanie Kane. I'm a foot and ankle specialist down in South Florida. Today we'll be talking about arthritis in your feet, but when we open it up to questions, we can go into any type of foot, lower extremity. I specialize everything below the knee. So any questions at all. I'll try to keep this kind of brief. If there's a lot of questions halfway through, we'll stop and then we'll kind of continue on the PowerPoint. If there's not that many, we'll try to finish the PowerPoint up and then we'll just go straight into questions for all the remaining time. So let's see how it kind of goes. You guys always have great questions. Let's see. So what exactly is arthritis? So it's a word that we hear so common. And as we age, we start feeling aches and pains and, the weather changes and doctors say, oh, it's arthritis. And so it's actually an inflammation within the joint in the body. So when you have a bone and a bone, you have cartilage that cushions that joint in between those two bones or multiple bones. And in between that, the cartilage starts to break down. And as that joint space kind of breaks down, the cartilage breaks down, the joint space gets narrower and narrower, and eventually you become bone on bone. There's no nerve endings in cartilage. So as that cartilage starts to break down, you don't always feel the pain. However, when the bone starts to touch the other bone is when you start feeling a lot of discomfort because of the fact that the bone actually has nerve endings in it. And that triggers pain, that triggers loss of motion, that triggers bone spurs, and a lot of those kind of issues that we see with arthritis. So it's actually just an inflammation of the joint that kind of either comes from an inflammatory reaction or it comes from a previous trauma. There's a lot of different types of arthritis. There's over 100 types of arthritis, actually. The most common that we kind of see are what's called osteoarthritis. That's degenerative joint disease. That's usually the wear and tear one. We'll talk about that a little bit today. You have post-traumatic arthritis after any kind of trauma or injury, fall, break, and rheumatoid arthritis, which is an autoimmune disease, in which your immune system actually attacks the joint. And that usually is seen on both sides of the body rather than just in an individual joint or one side of the body. You have gout and pseudo-gout, which kind of as arthritis. That's when you have a buildup of uric acid in your body with the gout. Septic arthritis is when you have an infection within the joint. Psoriatic arthritis, lupus, ankylosing spondylitis, reactive arthritis, Lyme disease, Sjogren's disease, inflammatory bowel disease, Crohn's, ulcerative colitis. Those have a lot to do with, there are also inflammatory reactions within the body and arthritic conditions and so many more. So today we'll be focusing on the most kind of two common ones, which is osteoarthritis, that wear and tear, and rheumatoid arthritis, which is that autoimmune inflammatory reaction that your body has. So some risk factors of arthritis. So biomechanical imbalance. And what that means is the way you walk, the way you use your body, the wear and tear you put on your body, what kind of steps you take every day, the activity level, any kind of previous traumas, trips, falls, breaks. They could have happened when you were 12 or they could have happened when you were 82. They could all lead to arthritic conditions and put you at a risk factor for arthritis. Obesity, unfortunately, we carry a little bit of extra weight. We put that extra weight on our joints, which kind of put a little bit of extra pressure in our joints, and kind of, we fight that a little bit. And the breakdown is a little bit higher with obesity. Family history, you'll see it common. A lot of people have family members with they'll say the deformities within their hands, and they notice their crippling of their toes and bunions and whatnot. A lot of that stuff actually is from arthritis. Smoking, patients who smoke have a higher incidence of arthritis and arthritic conditions as well. And then age. As we get older, we definitely have put our best years and kind of put a lot of pressure on all those joints. So we definitely see it with an increase in age, but you can see arthritis in all ages as well. So starting with the osteoarthritis, which is that wear and tear arthritis. And what we see in the foot and ankle is you'll feel some pain, some aching, the stiffness in the joint. Maybe that joint doesn't move the way it did before. You may see bony overgrowth. It may be red and warm when it's really painful. People with osteoarthritis, actually 24%, which is pretty high if you think about it. That's almost a quarter of the people with wear and tear arthritis will experience foot pain, and another 15% will have ankle pain. So we see it pretty common down in the lower extremity. A lot of times we'll take an x-ray, take a look at the joint, see how much space there is between the two bones, see any bony overgrowth, see the quality of the bone. Your doctor may order an MRI, a CT, a bone scan if something is, concerning. And then sometimes in the office, when you do come in, you get like a nerve block injection. If it's kind of in that joint and it helps, then we know it's, that's where the pain is coming from. Sometimes we drain the joint and send it to the lab. We take a look at it under the microscope and see what kind of inflammatory reactions are kind of going on there. So we're able to better treat it. So we talked about in the foot. So this is just a picture actually of the foot, that big toe joint right in the middle. That says 7.8%. That's a really common spot to see osteoarthritis, as well as in the midfoot, 12%. So a lot of patients will come in with pain in either and say they have a bunion, or they'll have pain in their midfoot and think they have plantar fasciitis or arch collapse. And a lot of times it's just a lot of arthritis and arthritic conditions going on in that area. So what's the burden of osteoarthritis in the foot and ankle? So 69% of people who have osteoarthritis in the foot and ankle will actually experience disabling pain. We never want a patient to have disabling pain. Functional limitation and impairment and balance, strength, motion, that's all kind of important to have, especially as we get older. We want to make sure that we have every step is, the perfect step for us to take. If you have disabling foot pain, you take a step and you're having that pain, puts you at a really high risk factor for falls. And that's what we try to avoid. So when the pain is bad, you have an increased risk for falls. You don't want to go out as much. You may be canceling plans. You may not be exercising. So you put you at a way lower level of like social activity, and your physical health can suffer. You may be calling out of work or, volunteer work that you usually do. And then actually, with primary care doctor consultation, about 8% of primary care doctor consultations are musculoskeletal consultations. And so it's a really common cause to see your primary care doctor for arthritis, and then they refer you out to a specialist. It's also important to know that women are at a higher risk to develop arthritis than men. So we talked about arthritis in that big toe joint. If we look here, I don't know if you can see my mouse, but that big toe joint right here is all arthritic. It's bone on bone. It has a lot of bony overgrowth. A lot of patients will come in with painful bunion. However, it is considered a type of a bunion. It's not the typical bunion though that, our grandmas had that kind of just fell out into place. It can be associated with foot pronation. And what that means is that you kind of roll your arch and ankle inwards slightly when you take a step. And you may have had previous trauma or injury. In the midfoot, the same thing. You have that increased pronation. That means you're rolling your ankle in and the foot in. You'll see increase in pressures in that midfoot. Again, we talk about the obesity, diabetes, and previous injury and trauma that can cause it to be kind of increased in the midfoot. And then the ankle, this ankle joint is completely bone on bone. In the ankle, it's usually post-traumatic. So someone had an ankle fracture or a fall, some kind of traumatic car accident. And about 70 to 78% of osteoarthritis is post-traumatic in the ankle. So like we kind of said before, pain and stiffness, swelling, pain on palpation. If the doctor touches it, you're kind of jumping out of your chair. You don't have that range of motion that you did prior. You may feel cracking or hearing like bone motion in there when you kind of move it. You could have bone spurs going on or bony overgrowth going on. You're going to have tenderness when you touch that joint. You may have trouble moving or walking, putting weight on it. Like we talked about the joint stiffness, the warmth, the swelling. It's common after a rest to kind of get up and have that pain if you're sitting or sleeping, kind of resting it, and then you kind of move to have an increase in pain. And the doctors may go ahead and order labs as well. They want to rule out other causes. They want to make sure that it's an inflammatory reaction, that it's not rheumatoid arthritis, or any other kind of inflammatory issues that may be going on. Are there a lot of questions? You want to fly through rheumatoid arthritis? Let me see. I don't know where it went. We'll just go through rheumatoid arthritis real quick, and then we'll get to everybody's questions. So rheumatoid arthritis is an inflammatory disease. It causes pain and stiffness in the joint. It's really common in the hands and feet. You'll see like crippling of the hands, and kind of same thing with the hammer toes and the bunion deformities. It's usually seen in the smaller joints. That's why we see it in the hands and the feet. And what happens is the joint lining in between those joints, it swells up and it becomes pretty inflamed, and it slowly destroys the joint. About 90% of people with rheumatoid arthritis do experience inflammation in the foot and ankles in their lives. About 20% of those patients, it's actually seen first in the foot and ankle. So a lot of times we see patients come in with a red hot swollen joint. They don't know that they have rheumatoid arthritis until they kind of get a full workup, and we're able to kind of give them that kind of answer. You usually see it on both sides rather than just on one side, like we mentioned earlier. So some symptoms of rheumatoid arthritis: you may suffer from pain and swelling in the feet and ankles. You may have loss of range of motion. You may notice that the foot is stiffer than before. You may notice bony overgrowth. You may have a lot of pain in the foot after running, walking, any kind of impact activities. The morning stiffness is huge. It usually eases up, but when you get up in the morning, it kind of, it takes about an hour or an hour and a half to 2 hours to kind of get out of the body and kind of get that pain out. And then you kind of have an okay day, but the next morning it starts over again. And like I said, labs may be ordered to assess for the rheumatoid factor and other inflammatory factors to really confirm a diagnosis and treatment for rheumatoid arthritis. So some stats: women also have a higher rate of getting rheumatoid arthritis, and so almost about 2 to 4 times a greater rate than men. The peak age is usually around 70 years of age. However, it can develop at any age. I've seen patients in their 20s, with rheumatoid arthritis, and even younger. The foot is affected in nearly all people. Like we said, about 90% of people will experience a rheumatoid arthritic condition in the foot in their lifetime if they have rheumatoid arthritis. And usually it is that joint pain and stiffness. That's the most common initial kind of presentation that it shows. You may have tendinitis as well. You may get nodules, little bumps form. You may get tarsal tunnel syndrome, which is burning, tingling, shooting numbness to the bottom of the foot. It can happen in other nerve-related parts of the foot as well. That's just a lot of the nerve discomfort. This shows us that there is a tissue involvement as well with rheumatoid arthritis and that inflammatory factor within the body. So how can RA affect the feet? So what does rheumatoid arthritis do to the feet? So in a patient with rheumatoid arthritis, the body's immune system breaks down and it starts attacking healthy cells. That leads to the eventual breakdown and swelling of the joint. That joint protective tissue is gone, the bone goes on bone. But the rheumatoid arthritis is a systemic disease, so it affects the whole entire body, not just the foot. In the foot, we do see what you'll come in and say it's a bunion, a heel deformity, lesser toe deformities. So we may see hammer toes, really rigid, claw toes. That can lead to wounds. That can lead to getting calluses there. That can lead to infections. So we really want to keep on top of it and make sure that those kind of things don't happen. And you can have nail changes as well with rheumatoid arthritis. So what will treatment do? So you can go and say, hey, I can bear this. I don't need to do anything. Or you can start to kind of treat it. And with treating it, it really will help relieve the pain. We want to maintain the foot function. So we can't go backwards in life. We can't go backwards in time, but we don't want anything to get worse. We want to improve the quality of life, meaning that we want you up and walking and doing. We want you back, at the gym with friends, going on those walks when it's not 22 degrees outside, and really enjoying life. Starting earlier on, you can use really safe and cost-effective treatment. So, shaving those corns and calluses down, orthotics, splints for the toes, for the bunions, wearing good supportive shoes. If you need braces, depending on what level of the arthritis it's already there and the breakdown already is there, there's a lot that can be done conservatively to maintain your foot from getting worse and maintain that pain. So treatment really will relieve the pain and maintain the foot function. Early intervention is key if you have any kind of symptoms. So we want to change your insoles, your shoe gear, make sure that you have good supportive shoes. Patients find relief from soaking their feet in warm water. Sometimes they'll go from warm water to cool water and, back and forth again, which is called contrast bathing. There is surgery for a lot of rheumatoid arthritis. Our goal is to kind of treat, or arthritis in general, our goal is to treat it without getting to surgery. Some doctors will treat it with steroids, whether it's long-term or short-term, depending on how much pain and how much discomfort you're in. Anti-inflammatory diets are awesome. That continue things like the Mediterranean diet, diets with fruit and veggies, whole grains, they can all bring some relief to that inflammation. Turmeric, cumin, all those kind of natural kind of things can really help as well. And smoking, not to smoke, but to quit smoking. Smoking can increase the severity of, rheumatoid arthritis symptoms, and it may kind of trigger the onset of rheumatoid arthritis. So some non-surgical treatment we kind of talked about a little bit. Physical therapy, changes your shoes, changes your orthotics, topical NSAIDs, anything kind of like that rubs on, that numbs the area. That can be diclofenac, it can be lidocaine gel, oral non-steroidal anti-inflammatory, so your ibuprofens, your Tylenols, your intra-articular injections are also very common. The hyaluronic acid is very common in the knee. You'll see doctors do, over and over and over again in the knee. Cortisone injections, lidocaine injections. So there are some injections as well that are still non-surgical, but you can still kind of get some management of that osteoarthritis or rheumatoid arthritis. Here is just a little bit of medication. So we talked about Tylenol, the diclofenac gel, which is topical. The Voltaren is awesome because it's actually just recently, within the past couple of years, over the counter. So you don't even need a prescription for it anymore. We used to have to write prescriptions for that. Pennsaid is one that is still prescribed. But ibuprofens, naproxens, the Mobix, the Celebrex. Mobic is also known as meloxicam. Doctors sometimes put you on a Medrol dose pack, which is a 6-day course of low dose steroids by mouth, and that can kind of decrease the inflammation. We talked about the injections. Sometimes patients do end up going on opiates or pain medicines like tramadol or some Percocets. Our goal is always to try to stay away from pain medicines, but pain needs to be managed as well. And then some doctors do treat it with antidepressants. They've seen, the research has shown some pretty good results with that as well. And then glucosamine and chondroitin tablets are also a way that they do treat the arthritis. Some more recent stuff, which is kind of cool going on, is acupuncture shows a lot of pain decrease and was a lot lower after acupuncture treatments. Transcutaneous electrical nerve stimulating, called a TENS machine. It's kind of a little unit that you put on, and it gives you a little electrical current. It stimulates the nerves for like a therapeutic process. It also releases a lot of anti-inflammatory reactions, and so patients have done really well with it with arthritis. The pulse electromagnetic field stimulation, the PEMF machine, is also another one that has showed that it kind of showed a lot of decrease in all that. A big thing going on right now is amniotic stem cell injections or platelet-rich plasma, PRP injections into the joint. So amniotic stem cells is stem cells from a baby. PRP is your own blood spun down and taking the stem cells, and they actually take it and inject it into the area. And then we talked about the Hyalogen, the synovial fluid injections that a lot of times work awesome as well, kind of to bring back that cartilage lining that was gone and kind of give you a little cushion in that joint. And then, so with all this, really the most common question is, what makes a good shoe? Because that's your first start. And so changes in shoe gear really are our first step in conservative treatment. Some patients may need to change to an open shoe to avoid cramping in their toes. I know that's hard in a lot of the locations that you guys live in. If it's not warm all the time or it's cold in the winter, something that has a stable and firm heel. So a heel that you can't kind of bend back and forth. Something that the midfoot also, you can't bend the shoe up on itself. The top cover also, if it's padded, if it's mesh rather than if it's like a solid leather, sometimes a little bit more comfortable. No seams or anything kind of crushing on any bony overgrowth that you have on anywhere on the toe or foot. And then a shoe that fits your foot type, size and shape. So your friend may love that Skechers with the foam insole, but that may not fit your foot type. So we need to make sure that you're getting a shoe for your foot and not just what we're reading on Google or what our friends say. We want it the right size, the right shape, and we want to make sure that you're kind of getting the right support for your foot. So that was a brief overview. I know you guys are always filled with questions, so we'll go ahead and answer some questions.
Yeah, so I do, let's see. So there are definitely, if we can stop sharing this so I can get a better view. I see there's a bunch of questions in the chat, and then we'll jump into those chat
You know
questions.
what,
Yeah.
Many years ago, well, about in 2010, I fell and broke both my ankles. So I'm noticing that now, as I'm getting older, my foot is like creaking at night. So it like snaps while I'm in bed as I move it around. And I don't know if that's the ankle or maybe it's arthritis now going through from the ankle all the way to my toes.
So is it painful or just
You know
the
what?
creaking?
It's not painful, but it's like a snapping. And then sometimes I feel as if my foot is falling asleep.
So the falling asleep is probably pressure on the nerves, which could be from swelling and post-traumatic as well. Sometimes the cracking we hear is just like if you crack your knuckle and just some air in the area. Sometimes a lot of times it is the arthritis, especially if you have a history of the trauma to that area. And then other times it is like a tendon that kind of moves on a little bone in that area. So it's kind of hard, but if it's not painful, I would just keep an eye on it. The burning, tingling, numbness, that kind of sleepy feeling is usually pressure from the nerve, whether it's from swelling or if it's from the way you're kind of positioned, whether it's starting from the lower back or if it's starting, lower in the leg. That's usually kind of separate from it, but it could be due to the trauma if you are swelling up from that trauma.
Okay, that's great because I'm wondering if it has to do with I need a hip replacement. So now my back is
Could be
that
coming
lower
from the back
back. So
then.
now I think it's all kind of connected.
Yeah, the numbness probably is coming from the lower back. A lot of times it does come from the lower back. But the creaking could be coming from post-traumatic arthritis, or it could be coming from just wear and tear of the joint.
Oh, that's great. Thank you so
Of
much.
course.
Okay, and then I do see, so Linda chatted in. Are you seeing the chat, or do you want me to read it, or do
I
you?
think I pulled it up. Yeah. I should be good.
Yeah.
I'm after having knee surgery on my left knee about 5 years ago. I've noticed much more ankle swelling. So yeah, unfortunately, having any kind of trauma to the lower extremity, so even having elective surgeries, having trauma, it can cause long-lasting swelling to the limb. If it's usually just on the one side, it's most likely due to the trauma from the surgery. A lot of stuff goes on, especially when having knee surgery, that can lead to an increase in swelling. 5 years ago, the best thing, kind of the first line of treatment, like you said, you're watching your salt and sugar intake. So that is awesome. Compression to the lower extremity. So getting a compression sock on. The ones that go up to the thigh would be best because it's going past your knee. However, if you can't tolerate it, then kind of going up to the knee is okay too. If you're more concerned about the swelling down below, just know that it will pool around your knee, especially since you have that trauma to that knee and that surgery to that knee before. But an increase in temperature of the skin, redness, swelling, it's very common after having trauma or even elective surgery to the lower extremity. It has nowhere to go but down. We fight gravity.
Okay. And then I think there was Barbara Scala's comment, question. The talus bone, the ankle her ankle is not mobile. What can you do for the talus bone?
So I'm gonna guess that it's talar arthritis. So it's probably either your ankle because your talus bone sits right under your two ankle bones. So it's either that you're having ankle arthritis or having subtalar arthritis. If the ankle is not mobile, it's most likely your ankle bone or the bones, and with the talus. Unfortunately, depending on the degree of it. And so I don't know. I think I skipped a slide. I had a picture of braces and stuff. I must have flown by it, but the first line treatment usually is to get in a good supportive orthotic, and that may mean being in what's called an ankle foot orthoses, which is a very high up kind of brace to the ankle to give you that support so you don't have that pain. The ankle not being mobile sometimes leads to surgery, and so that can be usually a couple different things. Very common now, they're doing total ankle replacements. Total ankle replacements have been doing awesome. They've come really far in the past 30 years, I would say. Patients, it used to be that they just waited to the end and it was, 70 and up, we do it to get them a couple years. We've done multiple of them recently on kids in their 20s after trauma, after big accidents and whatnot, and they're getting their years out of them, or fusions of the ankle as well. Obviously, with a replacement, you have the range of motion back to the ankle. With a fusion, you lose that. The first kind of treatment, though, is to get kind of braced and see if you feel comfortable in just that orthotic and that ankle brace kind of holding and giving you support. Without x-rays and images, it's hard to say too.
Okay. And then Lenny Gross Young wrote in about this hand and foot syndrome secondary to side effects from chemo considered arthritis. I think I have neuropathy in my feet. Any ideas about that?
I wouldn't consider it arthritis. It is kind of an inflammatory kind of reaction. It is a side effect of chemotherapy drug, unfortunately. It does cause the swelling, the blistering of the hands and the feet. It's not necessarily within the joints. It's more the inflammatory, the drugs kind of cause the kind of reaction within the body, kind of causing that swelling, kind of causing that blistering. I'm trying to think. I know 5FU is a really common one that they do get, the hand-foot syndrome, but it's really not within the joint, I'd say. If there is a swelling or inflammation, the treatment kind of can be the same. So a lot of that topical kind of creams, a lot of the oral anti-inflammatories that are cleared by your doctor with the chemotherapy as well. You don't want to take anything that's not that treatment's far and first most important. That's why the side effects unfortunately do exist, but they still give the drugs because they do their job. But it's not necessary. It's more like a sunburn kind of redness to it. If you're having deeper pain within the joints, it may not be associated with that, kind of coming from the drug reaction. It was another part of that question, right? I think it just moved down. Neuropathy in the feet. Neuropathy can also be caused by chemotherapy. So that burning, tingling, numbness, that absence of feeling, not feeling the toes as much, then not feeling the foot, the numbness, not just that can be caused by chemotherapy. Chemotherapy is one of the top reasons why neuropathy develops. That outside of diabetes, alcoholism, I would say those pretty much like the top three. And then obviously nerve stuff from the lower back as well. So the kind of could be from the treatment from chemo as well.
Okay, and Anna, I do see your hand is up. Go ahead.
Yes, I had both of my knee replaced about 15 years ago. And I find now very hard walking. Is there anything you could do besides having another operation?
You said it's hard.
Knee replacement.
You said it was your knees?
Yeah.
So obviously I don't specialize in the knees. I did do a long rotation with an orthopedic surgeon during my training. And we did a lot of knee replacements and a lot of those kind of surgeries. There are a lot of times patients do go back in for whether they change out different components of the knee, if it was a total knee, or if they change out the polymer. The what?
I don't want to do that.
No, yeah, no. So the kind of, and then you develop a lot of scar tissue and stuff like that as well. Sometimes patients do well with therapy. They do well with injection therapy, trying to break up some of the scar tissue. If it's on one side versus the other and they did the same sized implant, sometimes it's just, wear and tear and kind of how you healed. That would be worth following up with the orthopedic surgeon, whether the one who performed the surgery or a different one, and kind of telling them you don't want to go back to surgery. There are some options to maintain the joint, so that way you don't have that pain and discomfort though.
Okay. So I do see your hand, Ernestine, and I do see your question. So I'm just going to get to Positive Pat asked, and someone else, I think Anne asked about collagen powder, and Positive Pat was, what are your thoughts on collagen, marine collagen, especially regarding the knee joints? And I do see that Anne had asked about that with collagen powder to help with arthritis.
So there's a lot of research coming out in the last, well, in the last like 15 years regarding collagen as a common dietary like intake. And they do show, and they focus a lot on the knees. So a lot of the research is on the knees. Does show that taking collagen, I think it was about 6 months was a study that came out this past year. Taking collagen for about 6 months did decrease pain and discomfort with knee osteoarthritis. So I didn't do the research, so I can't say anything personal. I do have a lot of patients that do take it, and they love it, and they feel like they do really well, but it does help to improve the symptoms of osteoarthritis and reduce the joint pain. And I think we're still in 2020. I think that study came out this year. One of them did come out. So it can't hurt to try and maintain your pain and try to avoid any kind of surgery or any kind of injections. And that's a great way of trying.
Okay. And Frida Smith stubbed her foot 2 years ago. Doctor said it was only a contusion and will heal in time. Today, it still feels like a sock bunched underneath the foot in her shoe. What could that be?
Stubbed your foot 2 years ago. So sometimes when we feel like there's a socked bunch under the foot, it's nerve related. It could have been that there is a neuroma in the area that was aggravated with that stub. It depends on how you kind of stubbed it. If it was like your toes down first, but a neuroma is a nerve that runs in between the two bones and the long bones in the foot. And it gets kind of swollen and kind of bulbous in nature. And then at that point, it kind of sends kind of like shocks or kind of a funny feeling to the bottom of the foot. The bunched up under the foot of the shoe, we also see with a lot of neuropathy. That's what they kind of describe as neuropathy as well. So it could be that it's from the stump that you kind of had and it was a contusion, or it could be that something kind of aggravated it and now it's kind of constant within you. But it's usually more nerve related when you feel that kind of bunched up under the foot. The only other thing sometimes does happen when you do stub is that soft tissue injury, and that can scar down, and that's what you may be feeling as well, that you feel like extra pressure there. It's hard with not being able to like touch and kind of pinpoint the pain for you, but those are sometimes the common things that we see with that.
Okay. And Ernestine, so you have a question here. Do you want to go ahead and ask it? I see your hand up.
Yes, I will. I'm going into 3 months of post left total hip replacement, and during the time of recuperating, I did develop like numbness in my ankle on one side, the side that the incision was on my hip. And I did call the doctor twice concerning it. And the nurse practitioner said that I would have to go to a foot and ankle doctor because they only go for the joints, and that was the hip joint was doing fine. But I am a post breast cancer and chemo, and I know I do have some neuropathy under my foot at times. I can feel like she said the bunching, like something is under my toe, and I know that's the neuropathy. But yeah, I still do have the throbbing. It just throbs in my ankle. It's no pain, but and especially at night and when I'm still.
So post total hip replacements, there are a lot of kind of, I don't want to use the word complications, but there are kind of, issues that can take place that can, you're changing something in your body that can cause, burning, tingling, numbness, or weakness to the foot. You don't feel like you're dragging your foot at all or slapping the ground though, do you?
No, I'm walking. I'm doing
back up. So that's good. That's good news.
Yeah.
But so a lot of times patients with neuropathy do have a lot of that numbness, tingling, weakness that does.
But it was the ankle was not. I've been through with chemo for about 10 years.
Congratulations.
So thank you. And so the ankle just started back after I had the total hip. So
it just okay.
It
so
just
I would
started. Yeah.
Are you having swelling too, or just
none? No swelling, no nothing. Just the throbbing at night, especially.
And then does anything help in terms of elevation or medication? or
Yeah,
anything like that?
sometimes moving around the elevator a little bit, and when I'm walking, it's okay.
So I would definitely, so the good news is in some of the more complicated things that I do see post hip, and obviously I don't do hip replacements, but
Mhm.
I do see my patients after, kind of what you're saying doesn't worry me as much,
Okay.
in terms of some of the things that can come from having the hip done. And so a lot of that, I would definitely follow up with the foot and ankle doctor if you're feeling like that pain at night. Pain at night a lot of times is nerve related. Nerves do act up at night, but also swelling can take place throughout the whole entire day and can kind of cause our body to kind of respond at night as well.
Mhm.
So
Okay.
that's what I would follow up then. But in terms of the hip replacement and then that throbbing the ankle, it could be nerve related, or it could just be, you know, kind of getting back to it, wear and tear.
Okay, thank you much.
Okay, and I see Elaine had a question, lupus, fibromyalgia, also HBP diabetic patient, and I am miserable at times, but I meditate and pray a lot. So any comments on that?
So definitely have a lot going on and inflammatory in the body and stuff. We don't want anyone to be miserable. We want everyone to, you know, be happy, but we all have our good days and our bad days. Meditating and praying is awesome. Making sure that a lot of those things with the inflammatory reactions, with the diabetes, diet control, just to kind of make yourself feel good on the day to day and really listening to the doctors. I'm not sure. I mean, I'm not sure if there's anything specific you want me to answer. I can, but that's just, you have a lot going on, and we want to make sure that you kind of stay on top of yourself.
Yes, and I agree. Meditating and praying, always a good idea for that, to get you in a different state of mind. So that is a good practice. And I do see that Anne also had another question. She wears SAS shoes, and they are all she can really wear. Are you familiar with SAS, and what do you think about them?
Yeah, SAS are awesome shoes. A lot of the diabetic programs, SAS is a pretty big option through them as well. Obviously, all different types of shoes like we discussed. So what Mary Jane may work for one person and the sneaker may work for the other may not work for you. So you just want to make sure that even if this shoe is known to be a good shoe, that it's what works for your foot and fits your foot and that you're wearing the right size. But SAS are they're very good shoes. They're comfortable and supportive, and I do like them.
Okay, and I see Rose, you had a question here. Do you want to go ahead and voice it, or do you want, go ahead?
I have two questions actually. Recently I did take a fall, and I couldn't feel that my feet were slipping out from underneath me. Unfortunately, it was in the shower when I fell, so I'm still recouping from that. But the thing of it is, I have a little bit of neuropathy. Usually I can feel things, but this, I didn't feel a thing. And it scared me, for one thing, and two, because I fell. And the other question is, I have the 2 second toes, not the big appendage one, but the second toe. One of them is actually, it goes up, turns to the left on the right foot, and then back to the right, and you know, up straight. And then on the other toe, it doesn't bend at all. In this, the joint does, other than the first joint at the back of the foot, that bends, but nothing else bends. And I'm wondering if that is part of why I'm not feeling things.
Well, it could be. So starting with the toes, it sounds like you said it was the second toe in from the big toe. So that's
Right.
actually, when we think about the foot, it makes a parabola. And so that second toe actually sits higher than the first one. So it does take a lot of, when you weight bear, it is very important for weight bearing. it sounds like you have like a rigid kind of hammer toe deformity. Now, it may not be that typical like curve, like you're describing it kind of going up and over, and maybe you had trauma to the area or something kind of caused it to kind of be off alignment. So it's not that kind of curve. Though, I mean, once it doesn't move, it's hard to treat without surgery. The best thing is kind of a little splint that goes under it to kind of keep it kind of away from gripping the ground and getting calluses or wounds. The gait itself, when you're talking about their feet coming out from under you, it is concerning when you fall. It usually is neuromuscular related. A lot of times, so when we take a step, we look at the ankle, the knee, and the hip. Those are like our 3 pivot points. So a lot of the times we don't realize how important our whole entire lower body is for stabilizing. There are nerves that are sometimes weakened, whether it's coming from the lower back or locally in the leg, and that can kind of cause you to, when you not take the step that you were mentally thinking that you were taking, and that foot kind of comes out from below you, causing you to slip and fall. The first thing I would say would be physical therapy, more focused on gait training, focused on kind of, there's a mental aspect to it as well as a physical aspect to it, and taking a step. We kind of take it for granted because we start walking when we're a year old, and we just kind of go for it. So we don't really think about it, but our steps become automated, and they become subconscious movements throughout life. And so sometimes things like neuropathy or nerve damage or traumas, or just kind of slipping on something, an uneven ground, an uneven surface, not feeling it the same way, can kind of cause us to kind of take a step back in a way, and kind of have to kind of train our body to take those steps the right way. I would make sure, you said that you do have some neuropathy and changes in the feet.
Yeah, light neuropathy. I mean, it's like standing on a bunch of newspaper or old paper bags.
So that also can influence that step that you kind of take. Making sure that you're wearing good supportive shoes. I know we've stressed that a lot this call.
Go ahead, Rose. We lost you there for a second. You're from the old school. Yeah.
I'm from the old school. I'm a baby boomer. So you might not understand, like when we were kids, we'd walk in the paper bags.
Yep.
It was like, it's walking in that. That's what I feel. But that, and then I also noticed that on my big toes, and I've had both of my toenails removed on both of those permanently because I had chronic ingrown toenails. But I get constant calluses on the outside of the toe. And I'm always I have a stone that I take them off with. But I don't understand why, because I wear good shoes, I wear compression hose, I don't understand.
So sometimes the calluses come from bone underneath. So even though the toenails are gone, there's bone underneath. And when we kind of have a little bit extra motion in what's called the midfoot of the foot, you can kind of get that little callus on the outside of the big toe. It really is a common thing and you can do everything right and still get them. I don't do everything right, and I have them and I know how to treat them. So usually it's just the shape of your bone. It's that joint there. If that joint developed a little bit of arthritis, if it had trauma at a point, if it's just the shape of your bone, and you just get that little extra pressure and little kind of callus to that area. Sometimes it does come from things like nails putting pressure, but your nails are gone. So I would say it's probably more from the way you kind of wear your feet. That doesn't mean you're wearing the wrong shoes or you don't have the good support. It's just the way your foot takes a step. Like a custom arch support can kind of help you with it. Is it worth the investment? So that way, you get the relief and everything you can. It may be. But the feeling of walking in the paper bags definitely sounds like a lot of nerve related. and it's worth kind of following up, especially if your feet kind of feel like they're slipping out from under you.
Oh, I did slip.
Yeah, so I would definitely follow up with that. And then just making sure you're wearing good supportive, non-slip shoes. You're not walking
Oh, I
on
do
really
that.
uneven surfaces. That if it's hard in the shower, you're probably not wearing shoes in the shower. But making sure that you're aware of the surface that you're on, and that you're not kind of missing it. You may just, in the meantime, take some little extra conscious movements to try to avoid the falling and the slipping.
Okay, thank you very much, Dr. Kane.
Of course.
Okay, Barbara Waldron, go ahead.
Yeah, I want to know, I have two questions. Every summer, my ankles, they get swollen, especially the right one. And I went to my doctor year before he had me, I went to therapy for it, but it came back last year and it came back again this year. And he gave me a topical ointment that's called diclofenac.
Diclofenac.
Yeah, something like that. Are there any after effects that has? That's one. And my next question is, how do I know the right type of shoes to wear?
So the swelling in your legs, we'll start there.
Ankle.
So in the summer, it's no matter where you live, I guess it's warmer. So heat actually causes your blood vessels to expand. And so like the feet, like we go against gravity. So everything kind of swells down there. So that's sometimes why we see a basic reason why we see an increase in swelling in the foot and the ankle in the summer or warm weather. Sometimes that does have to do with venous return, meaning that the blood kind of coming back to the heart, it's not pumping the same way it used to. So sometimes we do need compression, or we need to just kind of keep our legs up a little bit, watch the salt intake. But heat edema, so swelling in the heat, is very common. So unless the doctor had seen like a traumatic reason, whether it was a tendonitis or an arthritis or something of that sort going on causing the swelling, and it probably was from the summer, could have been some from vein related kind of venous return, but it's not uncommon in the summer. In terms of diclofenac, topically, honestly, there's not much that's kind of absorbed into the skin. It's a very kind of low dose that's absorbed within the systemic system. So it does kind of have a kind of the topical feel to it. You kind of get the numbness to the area. You kind of get a little bit of relief. There are some serious side effects to it. Most common things that I've seen though are really thickening of the skin in that area, scaling, kind of burning, tingling to the skin. But the side effects with everything. Some people do end up with nausea, vomiting, diarrhea, muscle aches and pains. But it's really not that common to see some of those more serious things.
Okay, and as far as the shoes, how do I know?
Oh, the shoes. Yes,
Yeah.
the shoes. So you want to make, I think I have a toddler shoe next to me actually. So so if you have a shoe, and this is not a good shoe, but you want to make sure that it doesn't bend in the middle. So this is what we don't want. So if you look at a shoe and it bends in the middle, that's what you don't want. You want to make sure in the back of the heel that you're not able to kind of grab it and move it from side to side too much. So this is not a good shoe. This shoe is actually bottom heavy. So you're going to be kind of, putting a lot of pressure on the ground. You want one that's going to kind of, when you take it in the middle and bend it, you're not going to be able to bend it. You do want motion in the midfoot or in the forefoot, of the shoe. So where that big toe joint kind of moves, you do want to have motion there. Some good supportive shoes, in terms of sneakers that I like, New Balances, Asics are awesome. Hoka's are great. If you shoot me an email, I can send you a shoe list over as well that has all different types of dress shoes. Patients really like now Vionics have a little bit of support to them, but they also have everything from ballet flats to dress boots. So you don't have to sacrifice kind of the look for like flip-flops and kind of, you know, shower shoes, beach shoes, OOFOS, OOFOS. Patients really like, they say it's like walking on clouds. A lot of them use them just in their house as house shoes. You want to make sure that it's good for your foot. So you want to make sure that the issue we see a lot of times is people, especially with online ordering and with COVID, people order, my foot's a size 9. I'm ordering a size 9. Well, not every brand, not every shoe, not every model is the same. So I could order, let's say, a New Balance size 9 in one model, and it fits perfectly. And I'm going to order in my next model, a different one in size 9. Well, that one doesn't fit right. You want to make sure that it's fitting to your foot. So just because you've been a size 9 your whole life doesn't mean you're still a size 9. So we don't get the same experience we used to get going to the shoe store and putting our foot on the Brannock device and the metal thing, and they measure your foot out and they tell you exactly the width. It's rare that you find that these days, but if you can find a shoe store that can do that for you, it's awesome. As we get older, a lot of different factors in our life cause our feet to change. So we may be a little bit more wide than we were before. Maybe we're wide in one brand, we're not wide in another. So those are kind of things to take into consideration when you are buying shoes, and making sure that they're right for you.
Thank you.
Interruption.
Helpful. Thank you.
And
Can
I
you
do see
send the list?
Benita. Anna, we'll get to you once I see your hand, but Benita had a question here. How to alleviate problems with thick, high toenails?
So thick, high toenails can be from a multitude of things. So it could be fungus in nature. It could be traumatic in nature. Those are usually the two big ones, and they could go hand in hand. If you were to come into office, and obviously we're not in my office, but I usually start by taking a look at the nails. Grinding them down is a common thing also to be done, on top of treating it to be a little bit thinner. So some of the antifungals also have a lot of natural properties now too. So they can kind of go in and kind of decrease the thickness of that, as well as kind of shaving it down every couple months to kind of, but when they get thick, they get painful, they put a lot of pressure. You can develop ingrowns in the area or infections in the area. So it is important kind of to alleviate that. If you have a file at home, you can kind of file them down. Don't go, watch the skin. Don't go too raw or anything, so that make you avoid any kind of infections. But that's kind of the easy stuff to kind of do.
Okay, and Anna, go ahead.
Yeah, I would like to have the list of shoes you recommend.
The shoes. Okay, so Stephanie, if you want to get that to us when we send out the recap, we can add that into the list so that everybody can get that list.
The other thing that I would like to ask you, if you have a spasm at night, what can you do?
Is
So,
that
like a
spasm
muscle
question? You can't avoid that question. That is like, that question is always.
So if you have a muscle cramp or a spasm at night, so the most common, they happen at night. You fall asleep and you kind of get like a muscle jerk, or your muscle kind of tightens up. It can be from fatigue or overexertion. It could be from dehydration. So making sure that you stay hydrated during the day and at night. Low magnesium, low potassium are two other reasons why we sometimes get them at night. If you don't use a muscle enough, you can also get it at night. So if you're laying in bed for, a week just because it's snowing outside and you just kind of don't want to do anything, and that's okay. We have those days. But you may see that you get that kind of cramping at night as well. Massage does help. The other thing is diet tonic water at night can help as well to kind of decrease it. But those are usually the kind of key things kind of to do at night, making sure you stay hydrated, making sure your potassium, magnesium levels are well, and taking any kind of like diet tonic water at night and massage. Sometimes it can come from an inadequate blood supply. So if you're getting it repetitively, it is worth seeing the doctor to kind of make sure that your blood flow is adequate to the muscles, to the lower extremities, so it's not coming from anything like that.
Okay, and when the toes get in that crazy moment of, they get crazy, and is it pulling the foot back? Does that help? Like by stretching it back? I mean, you look online.
That's what I do for my foot.
Yeah.
but it's kind of giving that massage and kind of relieving that cramp. You know, it's not the most comfortable thing to wake up to or to have at all, but it definitely kind of gives you that massage, kind of those tendons that are kind of grabbing, kind of forcing them to kind of release a little bit. And you kind of sit there and then kind of just massage it out. Diet. So diet, like DIET, tonic water, TONIC. So just normal tonic water that like.
What does tonic water have in it that it's made diet? Like, what do they put in it that's not?
So I think regular tonic water works as well, but it's the quinine in it. It's the quinine in it that does help with the muscle cramps at night.
So diet tonic water is that's positive, Pat. That's what she was referring to there.
Yeah.
Okay. These are very, very helpful. Is there anyone else that has any questions for Dr. Kane? Anyone?
Yes.
Yeah.
Pardon the interruption. I actually am on a phone call, not on the view. I had joined a couple meetings before. There was no option to raise a hand as what it's called. So yeah, I just wanted to mention, I heard a bunch of people ask about shoes. Maybe you can recommend, I use what's called Gravity Defier, it's the name brand. And they work very well for my feet. I have 2 bad ankles that were injured back in 2005. And there was a meeting that I called in before about foot problems also. And I mentioned my problem. And I saw this meeting, so that's why I'm joining now. And I just basically wanted to ask, I mean, is there anything that I need to worry about? Because, like I said, I've had this problem for so long, and I use these special shoes, and I just don't want to have to worry about. And I'm not old. I mean, I'm only 38, but I just want to kind of know some advice for in case when I get older, something that I could possibly try to take care of, you know.
Okay.
So do you like the Gravity Defier shoes?
Oh yeah, they work very good. They have springs in them, so they help with the balance.
Yeah. So I
I
personally
work
haven't
hard.
worn them, but
Yeah,
I personally haven't worn them, but I do know
out.
that the research that's come out in the past few years has showed that they do decrease pain within like the knees and the hips and whatnot. The most important thing, you know, going forward in life and kind of is making sure that you do exactly what you're starting to do, is taking care of your feet, wearing good supportive shoes, not overdoing it, listening to your body. Those are the important things to kind of really take care of. The Gravity Defier shoes themselves.
That's what worries me, because since I work so hard and I'm trying to see about getting a different type of work, because by the time I get to my 6-hour shift, I'm already wanting to, you know, quit, because I have about a 9-hour shift that I have to go through every day. And but it just, you know, it seems like I have to do it anyway. So I just want to know, I mean, as far as arthritis, I don't have it, not that I know of, but what would you give me some advice on? Maybe do I need to worry about? Am I prone to get it or something like that?
So we talked a little bit, and I'll just give you brief. We talked that there is, you know, familial history with it as well. Wear and tear if you're on your feet a long period of time can kind of cause you to have increase in inflammation. Having inflammation doesn't necessarily mean that you have arthritis. So inflammation within the joint doesn't necessarily mean you're bone on bone, or that you're breaking down that kind of, you know, breaking down that cartilage in the area. It is worth seeing the doctor, getting x-rays and getting baselines of everything for yourself, so that way you can kind of move forward with that and kind of take care of that. You're doing everything right though, wearing the right shoes, you know, taking care of yourself, and just kind of staying on that.
I did go to, I did get x-rays when that happened, and I was told it wasn't like a broken bone, it was just a fractured tendon, and the other one, the ligament, that's part of the ankle there, but not the actual bone itself. So, you know, I just went on about myself with it, and I've been like this whole time, and throughout the years it's been hurting, but, you know, just kind of deal with it. I never gone back to get looked at or anything like that.
Well, if you're not able to, my key thing with my patients always is if you're not able to live your life. So live your life, meaning that if you're not able to do what you need to do through the day, whether it's go to the grocery store, whether it's go to work, whether it's sit at home, and you're not able to do it without pain, then you need to listen to your body. So if you're saying that you can't work through your 9-hour shift, then it's definitely worth seeing the doctor again and trying to make sure that everything is where it needs to be, that you're doing everything right. And then, kind of going from there.
Yeah, it's so much that I used to try to work out and do exercise, but it's gone to the point where I can't do that because of my ankles. I can't put more weight on my ankles. And that would help me when I would exercise before to try to, lose weight. That way I wouldn't have so much weight on my feet, but it just doesn't work out that way. So I try to find a different way to not gain weight. And, that way I wouldn't be without exercise, but I still can't exercise because of that problem with my feet.
Yeah.
Yep.
So really, I don't know if I have arthritis, but just
a good thing is getting in a pool, getting on a recumbent bike, getting off of your feet to kind of do that exercise, like you mentioned, so that way you don't gain that weight. Those are kind of good ways of kind of staying active. That I think that was on the slide that I missed. Staying active without having, putting all that pressure and seeing if you feel better. You may need more of a brace to the ankle. If I think I remember we talked about last call too, at the end of the call. You may need more of a brace to that ankle to give yourself a little bit more support to get through those days.